what many people may not know is, what is TMS and how does it work? So transcranial magnetic stimulation is a form of brain modulation. What do I mean by that? Brain modulation is simply a strategy to modify or modulate the activity, the electrical activity of neurons, of brain cells. And really, it's all about electricity. It's all about the currents that flow from one area of the brain to another, networks, as we call them. And it has been shown very clearly through well-done research that the connections between distinct areas of the brain, for example, the anterior cingulate and the dorsolateral prefrontal cortex, different parts of the brain, have electrical abnormalities that don't allow normal connections. And this is very true of many patients who suffer from severe depression. So TMS uses small electromagnetic pulses to increase the electrical activity, to put it very simply, in certain regions of the brain, thereby increasing the bond or connections between two different regions. So it, in many ways, people have described it as re-energizes, awakens neurons, and it does this all without any pain, as you may have seen on YouTube videos or other social media, where comedians, actors, and other celebrities discuss it. It sometimes feels like a little tap or maybe a woodpecker, as was described by Neil Brennan on the Joe Rogan show with respect to how it feels. And it is very much non-invasive. There's no insertion of electrodes or surgical procedures done. Now, there are other mechanisms by which TMS is thought to become effective. The studies show that it increases neurotransmitters. It does increase blood flow to certain regions of the brain. It actually has been shown to increase the formation of new connections or synapses between different parts of the brain, which is in large part how this technique has been also studied for treatment of memory disorders such as dementia and Alzheimer's with success. And I touch on that on other YouTube videos and educational material. What I have seen in my clinic, that if TMS is done properly, and I personally use biomarkers with EEG, MRI navigation to really focus on specific regions of the brain anatomically and precisely, you could have greater than 90% success. And that number, greater than 90%, is unheard of in the medication world. So the best the medications have been able to achieve is between 30 to 40% success rate. 90% is unheard of. And that is those are the numbers that we are able to achieve with these types of brain modulation. I encourage you to learn more, and do not lose hope if you have these conditions. I've had patients who were battling these disorders for decades, and they are seeing flickering lights that turn into a big bright light at the end of the tunnel, and they have their life back. Thank you for your attention.